If you love your penis, this video is for you. I am Dr. George James, a urologist and pelvic surgeon. Today, we will talk about 10 things you should never do to your penis. Guys, I'm a urologist, and part of my job is caring for male genitalia. Honestly, I care about penis health, and you should too. In this video, I will share with you 10 things you should do for the health of your penis that you may not know about. Make sure to watch the video all the way to number 10, because the last one will surprise you. Write in the comments below your age and the type of breakfast you had today. Now, before I start the video, I want to ask you a big favor. If you've been following me for a while or have watched some of my content, please make sure to subscribe to the channel. And if you're already subscribed, make sure to hit the notification bell. I post content regularly on this channel, and often there is a lot that you might miss because it's so much. But I don't want you to miss out on great education all the time. I see that only about 10% of you watching are actually subscribed. So please, do me a favor and subscribe. Share this channel if you can with your friends because it means a lot to me to spread this information and help people worldwide get the education they need. The first point is very simple. Don't ignore your penis. Now, many of you may not realize this, but how your penis functions is a measure of your overall health. When we watch men who start to have erectile dysfunction problems, and we follow those men for 7 years after the start or onset of their issues, 14% of them have a heart attack. That's because we call erectile dysfunction the canary in the coal mine. But I always say it's a sign of health, because when you have strong erections and strong desire, that tells you a lot about your body. First, that you have good blood flow. Your hormones are working well. Your nervous system is functioning well. You are in a good mental state, right? Things aren't stressing you out. And you're not doing anything you shouldn't. Meaning, you're not taking something that might affect your penis health. Which leads me to the second point. Don't treat your penis yourself. I've seen everything. And let me tell you, there is no safe home remedy that can make your penis longer or thicker. There is no magic mixture that will make it grow overnight. No matter what advertisements promise you. I remember seeing an ad of a person pouring apple cider vinegar on their penis and claiming it grew instantly. I thought to myself, that makes no sense. But I understand there is desperation about penis health. So people are very eager to see something that can help them with any problem they have, whether it's penis size or erectile issues. And often these things are unproven, unsafe, and may cause harm. Let me give you some examples. This video is for the Arabic Family Doctor channel. One of them is jelqing. Jelqing is when men use their hands and pressure to stretch the penis in order to increase its length. This is problematic because many people who do this cause tiny fractures in their penis over time and injuries that can lead to erectile dysfunction. You can ask any urologist. We've all seen young men who overdid jelqing. And you know this, right? If you tell a man to do something good for his body, he won't do it halfway. He'll go to the extreme, so you overdo it, hurt yourself, and cause irreversible damage to your penis. So please don't do it. Another example is some men making homemade constriction rings. I believe if you've seen my video on constriction rings, I explained a case of a man who put a nut on his penis, and we had to use a special saw from the fire department to remove it in the ER. Guys, I'm not making this up. The man was drunk when he put it on. Then he passed out. When he came to the hospital, his penis was very swollen and couldn't be removed. Another man took a plastic Coca-Cola bottle, cut a ring from it, and hung it on his penis. This is not worth the risk. Buy an approved constriction ring. You can get one for about $20 on Amazon. It's much safer. These rings are designed to be easily and safely removed. The third point, keep your penis clean. I think everyone knows they should keep their penis clean. But what happens is men who have a foreskin sometimes forget to pull it back or clean and dry underneath, which can lead to diseases like balanitis, inflammation of the foreskin, which can be very painful. So make sure you always take the time to pull back the foreskin, clean underneath, and dry it. If you can't pull it back, that's a problem because penile cancer is very rare. But there are cases where people develop penile cancer because they couldn't retract their foreskin and therefore didn't see the problem. So I always advise people to be able to retract the foreskin, clean it, examine the penis, then put it back. Along the same lines, avoid harsh cleaning because some people use very strong or scented soaps, which may cause irritation. The skin of the penis is not meant to be cleaned harshly. It just needs to be clean. Let water and soap pass gently. Make sure there's no smegma buildup and stay clean. But don't be rough washing. Don't scrub hard because you might cause skin irritation or even wounds. The fourth point, don't ignore pain or other warning signs. If you see a problem with your penis, talk to your doctor. Don't ignore it. Sometimes it can mean you have a sexually transmitted infection or a urinary tract infection. If you see blood in your urine, it could be a sign of a kidney stone, bladder stone, or worse, cancer. It could be bladder cancer or penile cancer if you see sores or wounds. So guys, don't ignore these signs. I know it's very hard to go to the doctor and show your genitals and feel vulnerable, telling him what happened and feel judged because maybe you had unprotected sex. I totally understand that, but your body's health is more important. If you feel the doctor judges you, find another doctor. But in the end, we're here to keep you safe and healthy. And I'll tell you, one of the saddest stories I've seen in my career is when men ignored sores on their penis and had penile cancer. Penile cancer is very aggressive and very rare. You may have seen only a few cases in your whole career because it's so rare. But when it happens, it's very scary and exhausting. And people ignore it because they're very afraid. They don't want to do anything about their penis. But let me tell you, if you take care of it early, the damage will be much less than if you wait too long. The fifth point, be in control and be safe. Nothing is more attractive than safe sex. If you're having sex with someone and you're not worried about getting an STI or causing pregnancy, you can be completely open. You can be vulnerable, which allows you to have great sex. So always prioritize safety. There are many ways to practice safe sex. There are many types of condoms. You have to try to find the one that fits best for you. The thinnest, or the one that feels best. Involve your partner in this process. But please always be safe. And now regarding safety, I want to say also stay in control. Why stay in control? Because things can happen like penile fracture. If you have sex very roughly and your penis is erect and it bends because it perhaps hits the pubic bone, not accidentally hitting the vagina, but hitting the bone when pulled, you may break your penis. This is a surgical emergency. When this happens, you have to go to the ER and be taken to the operating room because we need to repair the tear. When it happens, the outer layer of erectile tissue or the tunica albuginea tears, it must be repaired. If you don't fix it and wait at home, about half of people will develop erectile dysfunction over time. So it's better to go to ER and have surgical repair to preserve your erection rather than facing erectile problems later. You will know when the fracture happens. Usually, you will hear a popping sound, feel severe pain, and your penis will become very swollen, looking like an eggplant. It's very important to maintain control. It's better to hold your partner's hips so you control the speed and angle of movement to avoid an accident leading to penile fracture and keep your erection strong. Another thing that helps is lubricant. I cannot stress enough how important good lubrication is. Guys, lubricant is fun. It makes things slippery and more enjoyable. You shouldn't feel something's wrong with your partner if there's not enough natural lubrication. This is a normal part of aging. Women lose lubrication as they approach and go through menopause. Sometimes younger women have less lubrication due to medications, genetics, or other reasons. This doesn't mean they're not aroused. The sixth point, don't make it hot. What do I mean by not making it hot? I mean you should keep your testicles in a relatively cool environment. The reason the testicles are outside the body, while the ovaries in women are inside, is because they need a very specific temperature to produce sperm. If your testicles are exposed to a lot of wet heat, it can cause changes in the body's ability to produce sperm, which may lead to infertility and might affect testosterone levels. So I say avoid prolonged exposure to things like hot tubs, steam rooms, and similar. Also, when you sit or use a laptop, try to have something between your genitals and the laptop. It's better to keep your phone in your back pocket rather than the front, because all these things emit heat and may affect testicular health. The seventh point, be gentle with it. What do I mean by being gentle? When you masturbate, try not to be too rough with your penis. Things like the death grip I talked about before. Basically, when you masturbate with a very strong grip, it's not something that can be replicated or repeated by the vagina, mouth, or anus. It won't work. You will find that your body gets used to that level of pressure and intensity, which you cannot replicate with another person. Then you may find it hard to get aroused or maintain an erection because it's so different. So what I mean by be gentle with it is try to masturbate in a way similar to what it will be like with a partner. Use lubricant and enjoy the pleasure. Don't make it a shameful experience like hiding in a corner as fast as you can. The 8th point, don't smoke and take care of your health. Guys, smoking will destroy your erections. 100% smoking causes erectile dysfunction, so don't smoke. People who smoke get bladder cancer. I see it a lot. It's one of the worst types of cancer because there are many camera examinations inside the bladder, and sometimes when surgery is needed. These are big operations that drastically change your life. Overall, your lifestyle is very important. Now, this is not sexy, not fast, and not easy, but it's very important for the health of your penis that you live a healthy lifestyle. Remember what I said in point 1, that within 7 years, 14% of men with erectile dysfunction have a heart attack, because erectile dysfunction is a measure of blood flow. It's a measure of many things. It's a vital sign of your health. So if you stay healthy, your erections will stay healthy. That means eating healthy food, avoiding smoking or excessive drug use, reducing alcohol consumption, and exercising regularly. Aerobic exercise and resistance training are very important. Aerobic exercise is good for blood flow. Resistance training is good for testosterone. All these things are very important and I cannot stress them enough. If you don't know where to start with a very small step you can't ignore. I love this book. Atomic Habits. I'll put the link in the description. You can apply this model to anything, and it will help you make positive changes in your life. And finally, try to reduce stress in your lifestyle. We don't talk about this much, but when you are chronically stressed, a little stress is good. We need stress in our lives. But if you are chronically stressed, this harms your overall health a lot, including your sexual drive and ability to maintain an erection. If you are a person who suffers from chronic stress, you should look for ways to reduce that stress and what you can do within your control to improve your quality of life. And the 9th point, be kind to yourself. This is because when I find men facing problems with their penis, they are very hard on themselves. They are very anxious about being with their partner, about their penis's shape and performance, and they live with huge pressure and anxiety about active intimacy with their partner. And this amplifies the problem, right? For example, I tell people, if you have a problem in the bedroom and can't get an erection once, the next time you try to have sex, you'll be thinking about it all the time, and this stress makes it hard to get an erection. Then you won't get an erection, and this stress escalates and becomes a vicious cycle. So be kind to yourself. Everyone has fluctuations in penis function. There will be times it won't work, and that's okay. Not working once doesn't mean your life is over. Things will get back to normal. But don't be harsh on yourself and don't treat yourself badly and get stuck in a bad stress cycle. Men don't talk about this. They don't share their stress with anyone, and that makes it worse. This leads us to the 10th point. Use it or lose it. Is there any truth in the famous saying, use it or lose it? Well, to some extent. First, sometimes people stop using their penis because they no longer get erections. Right? So they don't get erections with their partner, and they stop because they're embarrassed or stressed or their partner doesn't want sex either. But the problem happens if you don't get erections during sleep either. Then it becomes a big problem. Normally at night, you get 3 to 5 erections, and when you get these erections, it's your body's way of protecting your penis and ensuring it gets good oxygenated blood flow. When the penis stops getting these, you may notice that your penis starts to shrink a little, or the tissue feels different, perhaps due to scar tissue formation. So yes, if you stop getting erections during sleep, this may be a sign that you might suffer from penile shortening. The other thing, if you notice a decrease in sexual desire, which is often related to stress, hormones, or other things, and you start avoiding sex for a period of time, your body starts realizing it doesn't need it anymore. So sexual drive will keep going down because you're not allowing yourself to feel this desire. Although this may not be a problem for some, it may be an issue if you are in a relationship and your partner wants to have sex. I believe there are many benefits to having sex and intimacy with your partner. Regardless of your age or what you do, this is very important. You have to make an effort. Your partner also needs to make an effort. Not everyone wants sex all the time, but there is great value in intimacy. And if you missed my videos on how sex can actually save your life, be sure to watch them. And as always, we take care of ourselves because you deserve it.